Shekhar sir. Sir, I think, sir, most of the members have joined now. Shall we start, sir?
Yes.
Yeah, yeah. I would like to request Dr. Kashmira, please start the session. Please, Dr.
Yes,
Kashmira.
ma'am. Yes, ma'am. A very good evening from India and a good morning to all our participants joining from different parts of the world, respected dignitaries, esteemed faculties, dear students, and Ayurveda enthusiasts. On behalf of the Panchakarma Department, Mahatma Gandhi Ayurveda College, Hospital and Research Center, Datta Meghe Institute of Higher Education and Research, I warmly welcome you all to this international webinar on Ayurveda practices in Western countries. Ayurveda, the ancient science of life, is now embraced globally for its holistic and preventive approach. This webinar is a wonderful platform to understand how Ayurveda is being practiced, adapted, and integrated in Western countries. It is our proud privilege to introduce today's distinguished speaker, Professor Vaidya Dr. Shekhar V. Annambhotla Sir, BMS, MD IU, is a distinguished Ayurvedic physician, Panchakarma specialist, yoga teacher, and integrative health expert with over 36 years of global experience in clinical practice, teaching, and research. Classically trained at Nagarjuna University and Gujarat Ayurveda University, he has consulted more than 30,000 clients, performed thousands of Panchakarma therapies, and traveled across 30 countries sharing Ayurvedic wisdom. He is the founder and president of the Association of Ayurvedic Professionals of North America, Ojas Ayurveda Wellness Center, Global Ayurveda Conference, and Dosha Botanicals. Under his leadership, over 60 international Ayurveda conferences have been successfully organized. He has served as visiting and adjunct professor at several universities in India, in the USA and worldwide, including University of Pennsylvania, Mount Madonna, and Jivaji University. Dr. Annambhotla sir has authored and reviewed numerous scientific papers, contributed book chapters, and served on editorial boards of Ayurveda journals. His expertise extend to yoga, pranic healing, Reiki, and energy medicine. He has received multiple honors, including the Vishwa Ayurveda Ratna and Ayurveda Vishwakarma Award for his contributions to global Ayurveda. Through his teachings, publications, and leadership, he continues to inspire holistic health education and promote Ayurveda internationally. We are indeed honored to have him with us today. Now I humbly invite Professor Dr. Shekhar Annambhotla sir to kindly address the gathering and share his insights on Ayurveda practices in Western countries. Sir, the virtual stage is yours now.
Thank you.
Dr. Kashmira, I have to correct
Yes,
one
ma'am.
thing that the today's topic is that is the various TL methods in the Ayurveda. Okay.
Okay, ma'am.
So
Okay, ma'am.
I would like to request Dr. Shekhar Annambhotla sir. Sir, kindly illustrate over and kindly enlighten the particular and kindly give some their valuable guidance to all of us regarding this topic, sir. Please, sir.
Thank you. Thank you and good afternoon to everyone. Myself, Dr. Shekhar Annambhotla. I'm practicing and teaching Ayurveda more than 37 years in the Western countries, and now I'm a citizen of United States of America and established my practice and everything. I am the founder and president of APNA, Association of Ayurvedic Professionals of North America. And now, today is topic what we are trying to discuss. Ayurvedic practice, Ayurvedic teaching methodology in Panchakarma therapies. Last month, we have discussed about the practice of Ayurveda in Western countries, other countries like that. We talked about that practice of Ayurveda. Now, in particular, to the department of Panchakarma department and head of the department, Dr. Poonam Savarkar and all the dignitaries are here, and faculty and students and PhD students, postgraduate students and PhD students, as well as the intern students or BIMS students, and all the people are here. So what we are trying to do it here, we try to explain to you how the teaching methodology is there. I put in a nice PowerPoint presentation, and that presentation will be shown to you. Then we'll discuss. Poonam, Dr. Poonam, I'm audible and visible and everything.
Yes, sir. Yes, sir. Absolutely.
Good. Good. I'm going to share the PowerPoint presentation right now. So I'm going to back to full screen. Let me do full screen. So can you see me?
Yes, sir. PPT is visible, but it is not on the presentation mode.
Okay, let me do. How is
Yeah.
this? How is that?
No, sir. As like previous, sir. No any change at all.
No presentation mode?
No, sir. Not it.
Say a command.
Let me see. Same problem
Say
last
a
time also.
command.
Stop sharing.
Sorry, I'm
Again.
unable to process your command.
Share. Share. How is this now?
Sir, it is like previous, sir. No any change at all.
Okay. Okay, what is happening here?
Is there any connectivity issue,
The
sir?
connectivity is good. Just only what is probably happening here, live streaming. Live streaming is also happening. I have to stop live stream. Okay.
If I think if camera is off, then I think
Camera is
some
there.
problem.
Camera is there. And
Yeah.
what I did it, I live stream, I stopped. Okay. Then now I can share with you the PowerPoint. How is this now?
No, sir. It is not at all on
Participant can
presentation
now
mode, sir.
see your application. Why I am not able to share with the PowerPoint presentation? You are screen sharing. Yes, I'm sharing the screen now. 74%.
Dr. Shekhar, you are sharing the screen, but it is not in the presentation mode.
But at least you are able to see.
Yes, we are able to see.
Yes, PPT is visible, sir.
Okay, that's good enough. Because PPT is
Yeah. I think if font is sufficient to see, so there I think there will be no problem, sir.
Okay,
You
good.
can go with this also.
Then, okay, good. So, Ayurvedic teaching methods for the Panchakarma therapies, I'm going to talk about like that. And this is the information of the things. And this is already given some information about myself, what I taught and everything. And now we are this all the activities about what we did it in our country and everything. And this is my association affiliations and everything. So for a teaching methodology, what we try to do it for the students who wanted to study Ayurvedic Panchakarma therapist, we wanted to have basic training program of Ayurvedic lifestyle consultant program is required, which is a 500 hours of training program we do. That program involves like the Ayurvedic philosophy and Ayurvedic physiology, Ayurvedic psychology, Ayurvedic pathology, and Ayurvedic diet and nutrition, Ayurvedic herbs, and Ayurvedic subtle therapies such as marma therapy, pulse analysis, and tongue analysis, and then sound therapy, aroma therapy. Those are the simple therapies which can be incorporated like that. And then Ayurvedic Panchakarma therapy is what basic information we teach them and everything. Then yoga also part of the component we teach them in the lifestyle consultant program. Then they have to do case presentation, 20 class case presentation means what they do, our students when they're completing the program, they have to do evaluation of the clients and everything. And on the basis of that, they can give proper guidance how to practice and how to set up the things and everything. We will be monitoring that part and everything. So this totally theory is 310 hours and practicum is 190 hours, and totally it brings about 500 hours of training program. So once they completed this program, then we go to the Panchakarma training program that is called also 500 hours of training program. Prerequisite of the Ayurvedic lifestyle consultant program is required. In this, we have given a detailed information, Panchakarma therapist or Panchakarma technician, we call a technician or therapist. And in this, what is the introduction to Panchakarma, basic concepts of Panchakarma, importance of Panchakarma therapy, and Sneha Karma and its indications and contraindications and complications and management, how you do it, everything. So 20 hours of theory, 10 hours of practicum, 10 hours of self-study, like that. We divided like that. And the Svedana, same thing, Svedana Karma, and in the indications and contraindications, complications, and complications, and management, how you manage it like that, and everything. We'll explain that. Then Vamana Karma, and it's same way we do it with all the indications and contraindications. Virechana Karma and Anuvasana Basti and Astapana Basti. Two therapies we teach them. And Nashya Karma as also contraindication. And Rakta Mokshana Karma, which we do, we teach them here and we don't apply the leech applications, then Alabu and then those type of things. We don't do it here. But when they come to India, we will give a practical training program for them. Certain hours of training program we do. And same thing with the Virecha Vamana therapy also, we try to do it in India. We teach them like that. And those Shirodhara, Shirovasti, Pindasveda, Annalepa, Pijichil, Elakiji, and Navarakiji, Podikiji, and Kayaseka and Sirolepa, all the Kerala therapies also we incorporate and teach them the basics and everything, theory part and practicum part and self-study and everything is comes. So then, and then we'll teach them also specialty therapies like a Tarpana therapy, Karna Purana, Marma therapy, Griva Basti, Janu Basti, Hrud Basti, Merudanda Basti, Kati Basti, etc. So all therapies can be done. Panchakarma therapy, practical demonstration, 20 cases they have to take it and demonstrate various things like that. What we do, we tell them that maybe all the external therapies, they can show the Abhyanga therapy one time and Svedana therapy, how they can be performed like that. And they can also do the Hrudbastis and those type of things and Tarpana therapies and Karnapurana therapy. And if possible, Marma therapy can be taught and everything. That way we can do it. So this way, a Panchakarma therapist go through the 1,000 hours of training program fully with the basic level and next level they do it 2 levels of programs like that they will do it and full training program is taken place. This is the outlines of the program. People can adapt it, modify it according to the hours and everything. They have to bring it to 500 hours of training program. That's the thing. Our goal is that to have 500 hours of program. So we are approved by the National Certification Board of Therapeutic Massage and Bodywork. So this is a national organization. It's about already 100,000 people, 1 lakh people who are massage therapists in the country there. And those people can be taken these courses. Then they take these courses and educate themselves. So then they can incorporate Panchakarma therapy, Panchakarma program also. LMT and licensed massage therapist and PKT, Panchakarma therapist also they can do it like that. This is the way we do. Now, Panchakarma curriculum and Panchakarma training program curriculum like that. So in this, we are going through the individual wise history of philosophy of Ayurveda, 3 universal energies, doshas and 5 elements, Mahabhutas, and then we talk about that. And physiological disposition, prakriti and imbalances, and prakriti and dynamic imbalances like that. What is the how to balance them like that. Ayurvedic view of universe and humanity, humanity's place within us, and comprehensive introduction of the basic Ayurvedic concepts like Agni, Adoshas, Dhatus, Mala, Shrotas, and Marmas, and everything we discuss about that. And Ayurvedic psychology, we talk about that. Ayurvedic nutrition and the concept of detoxification and rejuvenation therapies we teach, and also principles of Panchakarma and how it works. How the principles are there, what are the principles, how you can do, and individually how the principles are taught like that. Like if you look into the dosha, kadachit kupitita, langana patindita, samshodana, then tesham punurudbhavaha. So that means when the doshas in the imbalance of state, these things, when you are removing from the root cause of the problem, then it will not reappear like that. That is the thing. The benefits of Panchakarma, we have to discuss everything. And indications and contraindications also, we clearly explain that. The process of Panchakarma therapy, how the Panchakarma therapy is processed and everything, it is also taught like that. And the preparatory phase, main process of the purification, post purification, repercussions like that and everything. So what are the processes and how you do it like that? Preparation for Panchakarma therapy, Dipana and Pachana and Snehana Svedana. This is the simple procedures we do teach them, and the main purification process and concept of Marma therapy. Marmas, as you know, that Saptottaram Marma Shatani. So 107 Marma points and their points and how it can be applied, how the things are there. That cannot be that can be taught in the advanced application of practice of Panchakarma, because once they learn the basics and everything, then we take them to the advanced level of Panchakarma principles like that. Review of Panchakarma process will be covered, including the Purva Karma, Pradhana Karma, Paschat Karma, and preparatory procedures, including various types of therapies like Snehana, Svedana therapies such as Abhyanga, Churna Svedana. Churna Svedana means warm powders. We can make it like this. Generally, in America, what we do, we take the like a coarse powder of chickpea flour and the chickpeas whole, and then oats. And also we take the mung beans and those type of things. Those combined together and with added with some vacha churna and as well as neem powder conditions like that. Those powders are coarse powders which are available. And also, of course, people who are sensitive skin, we also take the rose petals also, the coarse powder, we take it. And those things can be churna svedana, can be used like that. Then,
Dr. Shekhar,
yeah,
the presentation is not moving ahead. We are still seeing the initial slide itself.
oh, it's not moving.
Yeah, now it has moved to the second.
Okay, now it came to the normal. Now you can see.
Yeah, the second slide.
So you,
Third. Yeah, now it's moving.
it's moving in, huh? Okay. So first, let me show you again slides. And this is the first slide, second slide, third slide, and you are able to see now.
Yes.
Good. So we talked about the principles of Panchakarma therapies and everything, advanced principles, we talked about that. And then Snehana Svedana therapies such as Abhyanga, Churna Svedana, Patra Potli Svedana. Patra Potli Svedana means what we do, we have some herbs which are uh, herbs are not easily available. That's the reason we have to take some herbs which are very commonly available like that. We have leaves which is we don't get all the datura. Sometimes we can get it some of the things, but all the herbs are not available. So patrapotli pendusveda is very difficult to get it. But what I did it, and recently when I went to Bangkok, I found some poultices. That poultice bags and everything. So those bags, I soak them overnight in the water and everything. I keep them there. That poultices, I use them. Even though the herbs are there, then the poultices can be used. Sometimes I use the same oils also, I dip them like that. These are all the various herbs which are locally available here. Portals are available. Even you can buy from the Amazon also. And it's a large quantities you can buy it according to sizes like that you can buy it. And then I bought some herbs, dry herbs also from there that I can boil them in the water. That can be used as a decoction to press it like that. So Ayurvedic way of doing like that, there are so many ways to do it because nana aushadhi bhutam jagat kinchit upalabhyate. That means every herb having medicinal qualities. That is the way you need to look into that. So Ayurveda is a universal medicine, the global medicine. Whether it's for example, in Bangkok and Vietnam, those places where you cannot get all the herbs, you have to utilize the local herbs. And according to the taste, you can see the rasaguna viryapakas and you can classify it like that. So Madhura Amla Lavana. Madhura Amla Lavana rasas are predominantly like that. Vata Shamana qualities are there. Vata person, we can give sweet, sour, salty. So these are the things what you can do if we are making something oil or something. So sweet herbs, you can take it in a Chinese herb, you can take it, or a Thai herb, anything you can take it sweet herb. Along with that, you put a limbu raso, add limbu, amla. Then little bit of salt. Salt is exfoliating. The Himalayan salt you can take it, and then you can take a sesame oil base. You can take it, or any oil base you can take it, and combine with that way you make the oil, your own oil. So you don't, not necessary that a lot of people we think about that. Oh, I don't get the oils. I don't do it. That's why I'm not practicing Ayurveda. I changed my profession to the different. I mean, now I become a software engineer like that. That's not a way. If you have passion to do it, any way you can do it. That's the thing is very important here. And Patrapotli Sweda, Navarakiji, and we have in the even the Chinese grocery stores and Indian grocery stores also you can get matta rice and red rice and everything is available. That rice you can buy it. That is the Navara kg can be used like that. Kati Vasti, Shirodhara, and lepams, various types of lepams we can make it like that. I generally use different types of clays also. I use French clay, calendula clay, and yellow clay, and green clay, and all the different types of clays are available. Those clays I can mix it up together along with the herbs together and make a paste. That is a very powerful way to remove the toxins from the system and everything. Pichu is a very cotton balls made with the cotton ball. Then in that cotton ball we mix up the herbs together and everything. That soak them in the oil and everything. Then apply it in the localized areas. Sometimes in pichu it can be applied in the belly area, belly button area, or in the heart area, or in the forehead area, and in the head, middle of the area. This is the Brahmarandra area where you can do Adhipati Marma, where the Adhipati Marma is there, that's the area you can put it. Sometimes palms also you can put it like that. So various locations can be put it. How, why it is happening there? It relaxes the nervous system. People, a lot of people having majority of the 80% of the diseases are connected to the Vata disorders. So we look at the Vata disorders are more predominant like that. That's the reason we wanted to teach them that way how it can be helpful further. It's a very powerful way to do it like that. Very non-invasive and very simple and easy, very effective way to show the results like that. You are able to see the slides now? That Rome, can you see
Yes,
the
sir.
slides?
Yes, sir. Yes,
Good.
sir.
Yes,
Yes, sir.
The
yes, it's
five-fold
moving.
Ayurvedic detoxification process such as Vamana, Virechana, Anuvasana Basti, Niruha Basti, and as well as the Nashya therapy. And this can be also very well demonstrated like that, very clearly done like that. So, but the quantities, whatever the quantities which we are giving in India is different from here. People who are having a very low doses, we start working with them. So, for example, Kashaya Basti, if you are giving, and that is about almost like 500 milligrams to 700 milligrams we give ml of liquid. So it's a big quantity. Whereas generally in my practice, what I do alternative therapies like that. One day oil therapy, and second day basti, big therapy like that, big basti. And because for them, Anuvasana basti, Niruha basti, those words which you explain to them, they don't know anything. Small basti, big basti, oil basti, decoction basti. This is easy to explain like that way. So that's easy to do it, that type of things. And then specific food we prepare. Here, a lot of people having allergies to the lot of gluten intolerance, lactose intolerance, and everything, and certain types of foods people they don't like it. That what we do, we try to before Panchakarma starting, we take the evaluation what type of foods they don't like it. And what sometimes some people they don't like broccoli, some people they don't like the cauliflower, some people love eating a potato, a lot of potato. That's the thing. We change according to their condition like that. Sometimes sweet potatoes like that, they like it. So we give simple food, low caloric food, more khichdi diet. That's the best way to do it. Then lifestyle modifications. Like a lot of people, they try to go to bed late and go to bed and wake up late and everything. These things slowly we change the habits of generally, when we are doing Panchakarma therapies, we ask them to come for consultation first, initial evaluation. After consultation, doing like that, then what we do, we ask them to go for the small step by step to do detoxification therapies like that. They can do it in the some herbal teas, Panchakarma herbal teas also we prepared according to Vata, Pitta, Kapha, Doshas. So according to dosha conditions, we prepared the teas, herbal teas. Those teas they can drink either with jaggery or molasses, something like that, or they wanted to have plain, they can drink, or if you wanted to have lemon juice, they can mix it up and drink. Then After that, after things Panchakarma is done, some rejuvenation modalities we explain them what is the best way to go back to the normal diet and everything and healthy way of eating and everything. So it takes time for them to go. Even we do the Panchakarma therapy. I will tell you how we do the Panchakarma therapies, how many days we do and everything. I explain in the future charts. So practical session, how the practical session what we do. First of all, we teach them scope of practice of Panchakarma technician. What is the scope there, technician scope? So you have to be careful. What are the rules and regulations they have to follow, or the guidelines are there, and everything can be done. Review stages of benefits of the Panchakarma. Different stages of review of the Panchakarma before Panchakarma, during Panchakarma, after Panchakarma, what changes are happening, and everything you have to be. Guideline for the client's diet and lifestyle during the Panchakarma, what are the guidelines they have to follow and everything, indications and contraindications, safety precautions for the technician. So a lot of times in the Western countries, contagious diseases are very common like that. Some of the things are viral warts and those type of things. So generally in my practice, I generally use gloves, nitrile gloves, which is not a latex gloves, nitrile gloves. Like a technician, they use it like that. I full gloves, I can use it. But still you can feel the skin touch like that. I try to use it. Initially, when I started my teaching my practice, I started getting warts on my hands. So I noticed that, oh my God, what is happening to my nose? And warts are very dangerous. It won't go away easily. It takes a long time to go away. And you should not get as a therapist, as a practitioner, as Vaidya, you are involved in this therapies like that. I try to ask them that to keep your hands to be clean, nice. Even though my hands, I did 30,000 massages, my hands are very strong and everything like that. So what you have to do, you have to keep your energy, exercising, moving, and the hands and everything, exercising like that. Important. Not to use completely. We tell the students what are the precautions they have to take it. Don't use only thumb. If you are pressing too strongly thumb, what happens after some time? You lose carpal tunnel syndrome, that other problems are there, and knuckles, you have to use the knuckles more. And elbow, this area, that's the thing you have to rub it, some of the things like that. You have to be, and even the standing position also very carefully in a slant 45 degrees angle you have to stand. That way you are not straining your knees and these things. I always keep the kneecaps and everything for them. That way protecting myself like that. That way I am protected myself. That everywhere I am protected like that, every level like that. So that's the thing is very, very important. You use the scrubs for the clothing like that. That way you don't damage the clothes with the dirty oils and everything dirty make you go that the scrubs can be there. It looks like a more professional looking dress code is you are maintaining, and your hygiene is also important. If you are smelling badly and you are eating something that you are smelling badly, and make sure that your mouth is clean and everything like that. It's not breathing is very clear and everything. So the practitioner, technician, vaidya, everybody is to be cleanly, properly there. Not like a lot of beard and everything is there. Snow, these things are not of a nasal passages and ears and eyes and everything is clean properly like that. Nicely protecting like that. Even the women who are there, not completely cover their hair and everything, not falling on them and everything. They are also needed to be covered. Female therapists also not to show their private parts of the body and everything, covering their breast area and everything. And it's very protective way they have to do it, like not inviting way like that to do it like that. That is the way when it's not a place of sexual relationship like that you are not doing it because they're almost like patients are naked and everything. There's only having a loin cloth or some small underwear is there, disposable underwear is there. They have to maintain that privacy and everything. They have to protect it well, very, very well. That's important like that. Then hands-on preparation of panchakarma, preparation of the client, including the draping of the technique. Draping technique means we have two layers of the clothes. That then draping cloth is available, or you can buy the synthetic material which is there. That type of things also can be used. It can be disposable things like that. We buy in a bulk quantities of the draping cloths and everything. We cover the body. We cover the body and everything. Like modern medicine, how they do surgery when they are doing. If they are doing surgery for the hand, They don't whole body naked. They don't make it whole body naked. Or they're making the heart surgery, they will make in the heart area only. They're exposed that the remaining parts of the body they are covered like that. So that's the way they do it like that. A similar way we have to do it, the same protective way, like the mechanism, like the strokes and everything you are giving. So if I am doing in the right hand side, I will give the only right hand side, and then when I'm doing the left leg, right leg, I'm doing same thing with the left leg, like that, exposing the body. When I'm doing abdomen area, I have to cover that area, and breast area and to be covered, and everything that can be there. In the back, spine, and buttocks areas, all the areas can be properly covered, and everything they have to take it. These things, preparation, setting up the Panchakarma table and room temperature, room before the body work starts. So make sure that your room is comfortably, not too cold, not too hot. That is also very important that you maintain that temperature comfortable for the patient as well as you, and gentle music. If you wanted to keep a gentle music, you can ask them like that. Then like keep some chantings and recitations like that. Something is happening there that will be gives a more relaxation for them. Abhyantara snehana, like a oleation therapies, internal oleation, Bahya and external oleations can be done. Then Abhyanga oil application, Shira Abhyanga oil application on the head, Shura Abhyanga, and then Mukha Abhyanga, oil application on the face, and Pada Abhyanga, application on the feet, and Deha Abhyanga, the whole body application of the oils. So these are the 4 steps of the things. Oil application can be shown to the public like that. Then also, we teach them how to do self-abhyanga. That means they go back home when they are going to get the massage themselves like that. We give special oils, whatever the oil, rejuvenation oil, tranquility oil, vata balancing oil, pitta balancing oil, kapha balancing oil, tridosha balancing oil, and sometimes joint care oils. Certain types of oils can be prepared, and relaxation oils. So we prepare the oils according to their dosha conditions, imbalance conditions, then we can give them oils. Then so specialty abhyangas like a Garbhini abhyanga, prenatal oleation. So how the Garbhini Sri, the pregnant woman, how they can. Stutika abhyanga, post natal oleation, how the postnatal oleation can. Kumara abhyanga, how the teaching of the babies, how the things are there. Dry therapies like the children, how they have to do massage and everything, what type of oils can be tested and everything properly application like that. Prukshna, dry therapies like Udvartana and Swedana therapy, Anagneya Swedana, like a sedation without heat. So that is also warm compresses, warm towels, and everything can be given like that. And that's the thing. Upanaha Sweda, Agneya Sweda, sedation with heat. Like we use also steam tents, we use it here, and sometimes we use also that um, the steam boxes are there, which is having a heating generation is there, and then easy disposable, and they can work out very well. So mainly our purpose is that to get the sweating of the body. So then marma balancing therapies also we have to do it. The various shows of the marma therapies and how the marma points are there applicate. Some marma points are can be more deeper pressure is required. Some people having a lesser pressure is required. Those things are also there. So for example, head and neck area, 37 marma points are there. So Neela, Manya, Sira Matrika, these are 3. Vidhura behind, and Rikatika behind the Atlas area, on Ukshepa above the ears, and then Chanka, Apanga, Avarta, Stapani, then um, then Fana, Sringataka, and then Adipati. These are the various marma points. We show them that the things are there, how the things can be done. There are totally 14 divided into 37 points. 37 points, it comes like that. So then hand, Shipra, Kurcha Shira, Talahrudaya, Manibandha, Indravasti, Kurpara, Bahvi, Ani, Bahvi, and Lohitaksha, Kakshadhara. So these are the 11 points, 11 and 11, 12 points. Similar way, in the feet also, Kshipra, Kurcha, Kurchashira, Talahridaya, and Gulfa, and Indravasti, then Janu, Urvi, and then Lohitaksha and Vitapa Marma. Vitapa Marma is the perineum Marma. We don't touch that area, but we show them how they can do it themselves. There are certain areas we have to do it. Then similar way in the front of the body, like that, Guda Marma, we don't do it anything, Guda Marma. Then Nabhi Marma, Basti Marma, Nabhi Marma, and Apastamba, and Stana Mula, Stana Rohita, and Hridaya, and Apalapa. So in axillary area, that's areas we bring them there. In the back, Nitamba, Kukundara, Katika Taruna, and Parsha Sandhi, and then we have an Brihati, and then Amsa Palaka, Amsa. So these are the trapezius, all the areas. So totally it brings about 107 marma points are there. We clearly explain all the marma. See how I am able to by heart all the marma points, then I can remember those things. Then I can explain very systematically. And when they are doing these therapies and everything, very easy to do it. Then Tapasveda, dry heat, and Churnasveda, powder massages, powder boluses, we can make it like that. Herbal powders, poultices. So whenever I have free time, I combine the powders and everything together, putting them together. Then I make a powders and keep them bags. So how to teach them? How we teach them how to make the bags themselves like that. So nothing is wasted like that. And sometimes the rice we cook them with herbs and ashwagandha, shatavari, and those bala and herbs like that together with milk and everything. We make an annalepa. That's the thing also we do it. Sometimes I teach them also how to use kukutanda. Kukutanda means the eggs. Eggs can be used with combined with the castor oil and those things also. It's a little bit of smelling like that, but the thing for essential oils, I put them something to make it more smell, less smell like that. Eggy smell, and that I can use it like that. For the neuromuscular conditions, those type of things, neuromuscular dystrophy conditions, Parkinson's diseases, facial palsy, those conditions also can be wasting of the muscles, and those conditions I use it. Then Bhashpa Sveda, steam therapies and everything we use very easily. And then Patrapotli Sveda, leaf boluses, Jambira Pinta Sveda. Jambira Pinta Sveda means the big lemons are available, very easily available. Those lemons we take it and boil it in the things like that. We make that Jambira Pinta Sveda like that. And Sastika Pinta Sveda, rice boluses, Snehana Svedana, oil heat, Churna Pinta Sveda, policies and everything. Physical royal oil bath and kaya sheka, which is called physical, also can be done. In practical, some main Panchakarma techniques and specialty therapies like that we take into the consideration. The Shamana therapies include Takradhara, Shiradhara with herbalized buttermilk. So we make the Takradhara also. Shiradhara with herbal milk. Katibasti, warm retained on the lower warm oil retaining in the back. The katibasti dough we make it, and how to make the dough also we teach them how to make these things. Either they can make it, otherwise now tools are the Panchakarma tools are available. Plastic, the acrylic materials are there. They made it. That one we put it there, and then you can put this dough. Griva Vasti, we do it, and Janu Vasti. And main Panchakarma techniques and specialty therapies like that. So Pradhana Karma and Vamana Virechana, Basti, Snehavasti, how to prepare Snehavasti like that. That is also preparation, how to do it. Machikam Lavanam Sneham, Kalkam Kwadamiti. So this is a simple formula we do it. Machika means first honey. Honey slowly heated up. When it's become liquefied, slowly heated up. Machikam lavanam, we add salt in that and slowly heating up further. Machikam lavanam. Sneham, Oil. Any oil can be taken as an oil third and slowly heating up. Sneham. Kalkam. Kalka dravyas means like what we do, we make a powder form of some kalka powders like that, which is fennel seeds, those ajwain seeds, sometimes and caraway seeds, those type of things can be bacterial nature. Sometimes we use neem leaves, those type of things also can be used. So that can be used kalka, making a kalka paste like that. So Machikam, Lavanam, Sneham, Kalkam, Kwadamiti. So Kwada decoction is prepared, the herbal decoction prepared earlier, that decoction added to that and slowly stirring up, properly uniformly made it and everything. Then that one we put in a disposable and enema bags are available. Then each person we use one at a time. We fill it up and gradually and left lateral position. The person has to be lie down in the left lateral position and left leg is straight and right leg is bent and that way the colon and everything is straight forward like that way, and then you can give basti therapy in the early morning hours. So generally the basti therapy day, generally I go almost 6 o'clock to the office and make sure that they got elimination is done and everything. 7:30, 8 o'clock I give, and after that I'll give some oatmeal cereal or something lighter, or kanji or something I can give them that way to maintain these things and make them to get hunger until lunchtime. They can have a lunch. So then Nashya therapy is a very administrative way, like that, very doable like that. Steam also we do to help them more, relaxing more, and getting all the sinuses and everything cleared. First, before that, I do a lot of abhyanga therapy, massage, steam, gentle steam, and everything. Sometimes warm towels. Warm towels, I soak them in hot water and put them on the face. We have also towel warmer also available readily. Well, those things also you can put it there, and with a little bit of aroma oils and everything, you can put them there. And bloodletting and theory and everything it can be done. That can be theory part only, teach them. Then they come to India, and then we can teach them how to do leech applications and everything. That cannot be much useful for them. And then netra kalpanas like that, netra seka, giving warm compresses like that, ashyotaram, netra pindi, vidalakam, and netra tarpadam, and netra basti, Putapakam, Anjanam, these are all the different things we do it. And Shirovasti, Shirolepam, Shiradhumam, these are all the things we do it. And post Panchakarma therapies, daily routine, emphasis on the daily routine, seasonal routine, gentle detoxification of the home, and healthy diet, emotional balance. And this is very important. Spiritual growth. This is also encourage them to do spiritual growth and practices like that. And Rasayana therapy, like I said, a section of dosage and how the Rasayana therapy can be given. So the Rasayana therapy can be given Chavanprash and some other things like that, gradually increasing the dose of the supplements like the Agastya Haritaki and something Triphala Grutam or something like that to enhance the things like the Narasimha Lehyam, those type of things also can be given. How Ayurvedic Panchakarma therapies work in the USA. Modified practices, Panchakarma adapt therapies, completely local regulations and client's comfort. For example, bloodletting is rare and strong purgatives and emetic therapies are often replaced with mild detoxification programs. That's the thing they do it because in the bloodletting is the pitta rechara and also rakta dosha cleansing. So that's the thing we do it. Therapies focuses on Abhyanga oil, Shirodhara, Svedana, herbalized steam, and Basti therapies are often modified like that. And regulations and scope of Panchakarma is not licensed or regulated as a medical therapy in the USA. Ayurveda considers the complementary and alternate to healthcare practices. So this is the thing they look into that. So best ways to teach Ayurveda principles to the general public, online consult courses and webinars, what we are doing right now. And platforms like Udemy, Teachable, private Ayurveda institutions offer beginners-friendly content, and also they do also via Zoom and training programs like that. Workshops and community classes, local yoga studios or wellness centers are great places to teach Ayurveda one-on-one, dosha balancing, and seasonal routines, etc. Books and guides create a recommended simple guides like Ayurveda and everyday life or everyday Ayurveda cookbook like that. These are the things are very good, simple. Social media and YouTube share bite-sized practical tips on diet, lifestyle, herbs, and mindful rooted in the Ayurveda. And hands-on treatments like that, retreats like that, retreats and combine yoga and cooking and daily routine are very popular and very effective way to do it. So this is the Ayurveda center where we do the Panchakarma therapies. We did it like that here, and lot of things we do here. These are the Panchakarma regular consultations. We did it about 37,000 consultations like that. So now we do the Panchakarma therapy one day wonder. One day wonder means just one day they will come, get the half day. They can spend on 4 hours to 5 hours time. They get the taste of Panchakarma and how the Panchakarma is there. Abhyanga, Svedana, Shiradhara, and no bastis, those type of things. Invasive therapies, we don't do it. And then cooking classes and some beautification therapies, those type of things. We do it. Then 3 day Panchakarma is also moderation like that. And then 5 days is very good. And 7 days is more better. Then 10 days Panchakarma, and then 14 days Panchakarma, 21 days Panchakarma, 28 days Panchakarma. That way we can do all the varieties of Panchakarma therapies we do. And this is the way we did Panchakarma therapies for the various people. So this is the thing, how many Panchakarma therapies? 4,007 Panchakarma therapies we did since 1988. So it's continuously going on. So these are the various Panchakarma services which we do it, consultations, Panchakarma therapies, Abhyanga, Svedana, Marma therapy, hand foot massage, back, shoulder, neck massages, Kiji, and Vishesha, Udvartana, Dhumapana, Pindasveda, Grivavasti, prenatal massage, Ayurvedic facial therapies, Ayurvedic touch therapies, Rama therapies, Karna Purana, Shirodhara, Shiropichu, Garshana, one day wonders, and as well as Kati Basti, Janu Basti, Netra Basti, Hrud Basti, and Meridanda Basti, Pijichal, and Upalepa, and Nasya therapy, reflexology, meditation. So we need to give all varieties of therapies and head massages, heart stone massage therapy, heart stone ashwagandha therapy, like the heart stones, we put it in the body also, that will relaxes the muscles and everything. Vamana therapies and everything we do. So finally, our third Global Ayurveda Doctors Day we celebrate every year on this Friday, October 3rd. People who are interested, they can register. Please contact us if you have any questions like that regarding that. Please join again day after tomorrow. We are doing a third Global Ayurveda Doctors Day. And Ayurveda doctors having specialities there. They are contributing something that we wanted to have you there and speak in these things. And we wanted to contribute like that. Not only one person is doing, how the success they are doing, how many years they are practicing, how they're successful there, and what they are doing, and everything. We can share this information together. That's our goal too. And then finally, thank you very much for joining this week. And now we'll have an open for questions and answer session. And stop sharing. Good. So now I will take you questions and answer session. Gallery. Good. We have about 35 people are there. We have around 165 people registered. Out of that, 35 people, they are here. And any questions you have, open for you, all of you, and one by one, whoever wants to talk, they can talk. And a few minutes, and we'll be happy to discuss.
Sir, before going for the question session, I am very thankful, sir. Thank you for delivering such an enlightening lecture. Particularly this teaching and learning methods in the Panchakarma the way the way you presented the subject with clarity, depth, and practical insights has truly enhanced our understanding, really. And I think these are very helpful for our both PG as well as PhD scholar, as well as the practitioner and other faculties who are present here. And your ability to connect its traditional Ayurvedic wisdom with the modern educational approaches and modern practices in the Western countries is really highly commendable, sir.
Thank you.
We are very thankful, sir.
Thank you.
Yeah, I would like to declare the forum is open for the questions. Please, those who have queries, please raise their hands. Please put their queries in the chat box.
Yeah, any questions related to the Panchakarma therapies, how Panchakarma therapies can be performed like that? Because I love Panchakarma therapies, because the reason is that, of course, I love teachings as well as these things like that. We are doing these programs like that. If anybody interested to become a faculty of our institution, Global Ayurveda Academy, please contact us. You can teach from the online classes also. You can do small video clips of you are doing in the video presentations like that. You can talk about that in that video clips, show the students like that, a step by step, how can you do it like that, and that can be explainable like that, and that will be a very good way of to students to explain and to understand things, because they may not know anything like that. That's the thing. When they see, even the when we are teaching the dough mixing, what type of dough we have to take it, something in a wooded flour. Wooded flour we take it sometimes, and the wooded flour combined with the wheat flour combined together and make a flour, and some how much water they have to add, like a chapati, how you make chapati dough. So chapati dough like that, we make it like that, keep it there, and then after that, that dough can be used for the local application like that. That dough made it like that. So that's the way, is the best way to teach them on how to make a pottery, simple basic things of pottery, and all the different things you can teach. Any questions? Any questions? Raise your hand, and then we will take you as an you can ask any questions related to that. Yes, any questions? Kanchan, Dr. Kanchan.
Yeah, Dr. Bodla, it's a very good presentation. Very nice to hear from you and connect with everyone. One thing you said about your panchakarma, when you do it, after that it's very nice to know. But after that, you had the warts on your hand. So how did you try to get them off? How did you get the warts off from your hand? Like
washing the hands?
No, I mean, how did you treat them? Like,
what do you mean?
You had warts on your hand, you said?
We use gloves.
No, I mean you had warts after
Oh,
Panchakarma.
warts. How I am get rid of these warts?
Yes.
Okay, I use neem oil, echinacea oil, tea tree oil, this combination of oils. I was so frustrated what to do and everything. I started using the oils and everything slowly, and immune boosting. And I made some formula which is in a Mahasudarshan, and Mahasudarshan powder, and echinacea, astragalus, and rhodiola, and all the herbs together, ashwagandha, combination powders like that. The powder I was taking internally to improve my immune system stronger and everything. It took a time for me to completely eradicate the situation like that. Some people, they wanted to have oh, no, I wanted to have oil to be there, and hands to be touched like that, body. No, here I follow the very strict ethical guidelines, and also hygiene is very important for me. We don't know what to do and everything like that. Please take a shower if you wanted to feel that shower. Even shower also, it will not clean up the body and everything sometimes, because when we are doing the massage in the axillary area, axillary neck area, and those areas, commonly these warts are common for the people. So you have to be extra careful. Warts has to be taken care like that.
It's nice, nice to know from you. And
Yeah.
how much time did it take to get
It
rid
takes
of
about
it?
1 month. It takes
Oh,
1 month. 1 month it taken time like that, and you are
yes.
jeopardizing your practice and everything. Of course, during that time I started using of gloves and everything. And now, if anybody I'm touching the person like that, if I'm giving treatments and everything, definitely I will put the gloves. I have a gloves of almost 6,000 gloves are there. Big boxes of gloves are there. Always, whenever I touch the person, I give these things. After that, I can take it out. Average I use if I'm doing Panchakarma therapy for a patient before Abhyanga, after Abhyanga is done and everything, then I take it out. Then they can go into steam tent. Then I take it out again. Then again I put a new gloves like that. Repeatedly I use a lot of gloves in the hospital setup like that. I use a lot of gloves. So
Thank you so much.
welcome.
Thank
It's
you.
a good hygienic habit also in India also. You should use it because the previously condition is different now. More and more ethical things we have to do it like that, more probably like that, and also silence maintenance is very important, and more hygiene is also maintained. That's important. That's the thing is important like that.
Thank you. Thank you.
Welcome. Any other questions?
Yes, sir. There is one question from our PhD scholar and faculty, Dr. Satyajit Kulkarni, sir. I think he's asking about some any medical legal aspect in the Panchakarma.
Medical legal aspect, that's the thing. As such, we don't have any medical legal conditions now. That is the reason Ayurveda is not recognized in this America like that. Because first question they ask that in Colorado we try to get the licensing of Ayurveda. Licensing is only given for the people who are having a public threat is there. So that is the reason massage therapy is licensed. The barber is licensed. And why the barber is licensed? Because when he is cutting the hair in the above the ears and everything, he can cut the ears also, earlobes or anything like that with sharp scissors. When they are cutting the body and everything, they have to be careful and everything. Even they also should maintain the hygiene part very properly and everything. A lot of places they don't do it. Sometimes I ask them that can you put the every patient they have every barber has to use a new cloth for everybody. That means every day there are 30 patients and that 30 people they are doing 30 new towels they have to put it like that. But they don't do it. They wipe it off like that and they shake it and they put it back again on your body like that. It's it's not hygienic like that. Sometimes it's very difficult to get the haircut with the people like that. You have to be. That's the reason I have to be careful when I come back home. I put in some lotions and antibacterial. Sometimes I use some alcohol, rubbing alcohol that I mix with the water and everything. I wash my hair and everything properly like that. That's the thing is we never know what type of contagious diseases people who are having. In the Sushruta period also, Aupasargika rogas clearly mentioned that. Vastrabalyanulepanat, all they clearly they mentioned that Aupasargika rogas clearly mentioned these contagious diseases can become very frequently like that. People you have to be external is very good, and particularly alcohol sanitization is a very good way of cleaning of the system and everything. That will be very good. And medical legal aspects, what is happening that is the reason recently instead of licensing of Ayurveda in Western countries, we need to license the Panchakarma therapies. Panchakarma therapies should be licensed. Once that Panchakarma is a technique, a procedures and technique that has to be licensed. For that, you need to have a thorough knowledge of full training program is required. Like acupuncture is a technique. It takes smaller program. What they did it around the acupuncture program, they created all the components of the Chinese medicine, Chinese principles and philosophy, and everything they talked about that body work and everything. They put it that way. They made it 3-year program. 3-year program. One has to do a 3-year program, full training program, clinical training program, along with that herbology and everything. They add on like that. Then they did a bachelor degree, master's degree, PhD level program. They did it. So then people are licensed acupuncturist, licensed AY, licensed PK. LPK. LPK means a licensed Panchakarma therapist or Panchakarma. Licensed Panchakarma. So LPK, like that, licensing Panchakarma. Once you LPK is there, then you can go for the further Ayurveda and be incorporated like that. That is the thing is very important. And whereas the Kshara Sutras, those type of things are very difficult to do it like that. And Uttara Basti, those type of things also complicated. More complexity is that. That is the reason we avoid those type of therapies like that in the medical legal conditions like that. We try to avoid it like that. But you take the consideration into that way that very carefully you are doing Panchakarma, selected patients you are taking and doing the Panchakarma therapies as needed. Any other questions? That's the reason you have to take in liability insurances and protection and business licenses are required. That's the reason you pay a lot of money for everything. And average $15,000 to $20,000 per annum you pay for this. All the expenses are there. And in addition to that, your business licenses are required, and professional liability insurances are required, and organizational setup is required for promoting yourself like that. And that is the reason we have an APNA, Association of Ayurvedic Professionals of North America. We give the time-to-time educational programs, training programs for them. That way they learn more and everything. They interact with the people. Just now, recently, I did a conference. I can share you some of the photos. We did it in the conference just now and few days back. And I can share your desktop. And let me show you 70th conference and conference photos. So can you able to see these photos?
Yes, sir. Yes, sir.
See, this is the thing we did it just recently, Global Ayurveda conferences, and 2 days back we just completed. And in California, I did a conference there. And this is the mayor of the city. And mayor of the city, this is Carmen Montano, and she is the first female mayor. She came to our visitation. She is the homeopathy doctor, Reena Johari. She came and she is the facilitated this program and everything. And this is the global Ayurveda conferences and everything we did. And we have small videos also. Video clips are there. So this is a poster presentation. One of the medical student has given poster presentation treating of the major depression problems like that. That's the thing they did it. The various sponsors and exhibitors, they have shown some of the things like that. And the Global Ayurveda Academy, all the different things. And Ayurpath. These are the sponsors and exhibitors. They have shown that information to us. So these are the people, the companies, they brought their products, Surasa. Ojeska, Harmony Nutraceuticals.
Sir, whether there is any problem for opening that clip, sir?
They carry some of the products, various products like their education.
Okay. No issue, sir. No issue, sir.
Kerala Ayurveda,
Yeah.
and
Okay.
they have programs are there.
Okay, okay.
And this is
So,
Planet Ayurveda, Vikram Chauhan from Punjab, and he has
yeah,
center here, and he opened that
yes,
way.
sir.
And
Yeah.
this is then our mayor of the city and everything, and she's talking about that, some videos and everything.
So, sir, I think there is no query from any delegates now. So, shall we proceed, sir, for
Yeah,
concluding this session?
yeah.
Yeah, yeah.
So just
Okay,
I'm
okay. Thank you,
closing the
sir.
session
Yeah,
here.
yeah. I would like to request Dr. Kashmira kindly conclude the session, please.
Yeah. Thank you, sir, for giving us an insight on the Ayurveda teaching methodology for Panchakarma. As we have come to the conclusion of this wonderful session, I would take this opportunity to express a heartfelt gratitude to our distinguished speaker, Professor Dr. Shekhar Annambhotla, sir, for his valuable time and wisdom. We thank our respected principal, faculty members, organizing team, and all the participants for making this webinar a success. We extend our heartfelt gratitude to Professor Manish P. Deshmukh, PhD Deputy Director and Associate Professor of Pharmacology, DMI HER, for his constant guidance, encouragement, and valuable support in the success of today's webinar. His contributions and presence have truly added an inspiration and academic strength to this event. Before we conclude, I would like to virtually felicitate Dr. Shekhar Annambhotla, sir. Dr. Akshay could kindly do the honors.
Thank you, one and all. And I really appreciate your participation and enthusiasm. And definitely we'll continue our training programs. If you needed to have any special training programs from us, we'll be happy to do it. And if you have any questions, please feel free to contact Dr. Poonam Savarkar, who is the head of the Department of Panchakarma, and also the pro dean and all the vice chancellors and all the people who are there. We definitely connect with the university and Mahatma Gandhi Institute of Ayurveda and Ayurveda College, and as well as the Dattamega Institute of Higher Education, and we are very glad to connect with them. And I will be visiting probably in the month of December. First week, I will be planning to come to India. At that time, I will definitely meet with all of you in person. We'll discuss a lot of
Yes.
personal things and everything, how we can grow our Ayurveda certification program, training programs, and you can also come. Recently, some of the professors came from Karnataka to our conferences. Again, we do the conferences, online conferences, physical conferences, online conferences. Please, you can submit it as a speaker. If you go to the globalayurvedaconferences.com, there you can see the globalayurvedaconferences.com, where you can see all the next October we have this month we have an online conference, chronic fatigue syndrome, and we are also planning to write books and everything on the topics like that, various topics. We are going to take it that way, consideration publication like that. And Dr. Poonam is very involved in that area, and we are working on that area to improve that quality like that. Thank you, one and all. Namaste to all.
Thank you, sir.
Thank you.
Thank you. Thank you.
Thank you.
Thank you.
Namaste.
With this, we conclude today's international webinar on Ayurveda teaching methodology for Panchakarma. Wishing you all good health and wellness through Ayurveda. Thank you. Namaste.
Namaste.
Thank you, sir. Thank you very much.
Thank you.